Okay. So, dear students, in morning class only, we have seen the classification of all adrenergic drugs. And the classification chart is this one, sympathomimetic drugs. What are those? They are basically divided into directly acting sympathomimetic drugs and indirectly acting sympathomimetic drugs, as well as mixed acting. Now, this directly acting are divided into endogenous catecholamines. The next class is specifically drugs. Those are alpha agonist. Second one, dual. They are going to show the non-selective action, dual mechanism, that is alpha and beta agonist as well as antagonist. And the fourth class is specifically towards beta agonist. The next class is indirectly acting adrenergic drugs and mixed acting adrenergic drugs. So we'll see one by one. In that, already we have discussed everything about those endogenous catecholamines. Those are dopamine, norepinephrine, and epinephrine. So they are there. They are synthesized in our body, and they are going to show these many actions in our body. Now we are interested in actual classification of drug, that is second part, alpha agonist. So what are these drugs? Basically, they are going to be bind, or they are going to be act by alpha receptor agonist. Agonist is the drug which will increases the action of that particular receptor, which will bind specifically. सेम त्यांचं बाइंडिंग किंवा मेकॅनिझम सेमच असतं कुणासारखं बायोलॉजिकल सिक्रिशन्स सारखं. फॉर एक्झाम्पल, आता आपल्या बॉडीमध्ये एंडोजिनियस कॅटेकोलामाइन्स कुठले आहेत? इफिनेफ्रिन, नॉरइफिनेफ्रिन आणि डोपामाइन. मग या तिघांमधला जो कोण अल्फा रिसेप्टर वरती जाऊन ज्या पद्धतीची ऍक्शन दाखवणार आहे, द सेम ऍक्शन और सेम अगोनिस्ट टाइप ऑफ ऍक्शन will be shown by these drug molecules. So they are classified. Basically, they are classified into these many classes. Class number 1 will be, we have already known, phenyl ethanolamines. We already discussed that this is the phenyl ethylamine is the ring required to show the adrenergic response or adrenergic drugs. So what are these examples of drug? They are there in this class. See, please pay attention. So what are the examples of drug? The examples of drug is phenylphrine, methoxamine, Rito Drain. The next class is 2-aryl imidazoline. In morning class only we have seen what is the that we have seen the structure. Imidazoline ring type of structure is there, which is substituted with aromatic ring as well as a bridge X-carbonator. So there are the drugs which are going to be shown their action by this mechanism, that is 2-aryl imidazoline. The examples of the drug coming under this category are napazoline, tetrazoline, xylometazoline, and oxymetazoline. Next class is 2-amino imidazolines. See here, we have that time discussed that if they are attached to the aryl groups, the classification of drug is different. And if they are attached to the amino groups, the classification of drug is different. So the amino imidazolines are clonidine, apracolidine, and bramonidine. Then the next class is open ring imidazolines. Those are gonabens and gonifacine. And the next and very important class is Methyl Dopa. So these are the classes of drug which are going to show their action by alpha agonists. Now, a very important point which you keep it in your mind, that out of these, whatever syllabus drugs are there, that you need to study. We will discuss one by one very important drugs, but out of which what are there in your syllabus that you have to mug up or you have to take the you have to draw the structures of these drug molecules, or they may ask the question. So we'll discuss the first class, that is phenyl ethanolamines. All the classes under this phenyl ethanolamines are alpha-1 agonists. They are going to lack the catechol moiety, that is not metabolized by catechol O methyl transferase. See, what is the comparative point between this drug molecule and beta phenyl ethylamine ring? See, this is the structure of the drug molecule, that is phenylpherine. So what is comparative point? If जर आपण ही रिंग compare केली to whom? Beta phenyl ethylamine बरोबर. So what is the structural difference? This ring has lack of this hydroxyl group at the 4th position. So there is lack of catechol moiety. हा hydroxyl group नसल्यामुळे this ring is not converted into an catechol moiety. There is lack of catechol moiety. That's why it is not metabolized by which enzyme? Catechol O methyl transferase enzyme. जर इथं catechol moiety असती तर त्याचं मेटाबॉलिझम कशाने झालं असतं? Catechol O methyl transferase enzyme ने झालं असतं. But this is not the case, because thus they have long duration of action. That's why this drug molecule is not metabolized by this enzyme, that is catechol O methyl transferase enzyme. That's why this drug is going to have a long duration of action, that is duration of action is more. So the name of the drug is phenylpherine. It is used for the treatment of severe hypotension, severe hypotension, nasal decongestion. Then it is also used to dilate the pupils and in the open angle glaucoma. So जिथं अल्फा रिसेप्टरची लोकेशन असेल, heart muscles, nasal muscles, so there this is the drug molecule is used, that is phenylpherine, to treat the nasal decongestion. म्हणजे श्वासोश्वास घ्यायला जर त्रास होत असेल तर in this cold atmosphere. It is also used in the severe hypotension. एखादा पर्सन जर बीपी लो सिच्युएशन ने त्रस्त असेल तर ती सिच्युएशन आपण अल्फा रिसेप्टरचा हा ड्रग मॉलिक्यूल देऊन हार्ट मसलचं पंपिंग वाढवण्यासाठी करणार आहोत. Then it is used to dilate the pupils as well as in the open angle glaucoma. So glaucomaच्या ट्रीटमेंट मध्ये पण हा ड्रग वापरला जातो. Then the next drug is 2-aryl imidazolines. म्हणजे इमिडाझोलचा ब्रिज कार्बन ॲटम अरोमॅटिक रिंगने सबस्टिट्यूट असेल तर या कॅटेगरीतले हे सगळे ड्रग मॉलिक्युल्स कुठले ड्रग मॉलिक्युल्स आहेत? नॅफॅझोलिन, टेट्राहायड्रोझोलिन, झायलोमेट्राझोलिन आणि ऑक्सिमेटाझोलिन. All these drugs are alpha-1 agonists and used for their which type of action? Vasoconstrictive action. आता कालच आपण अल्फा-1 रिसेप्टरच्या ऍक्शन बघितल्यात. सो अल्फा-1 रिसेप्टरच्या ऍक्शन अगोनिस्ट करण्यासाठी हे ड्रग मॉलिक्युल्स वापरतात. व्हॉट आर दोज ड्रग मॉलिक्युल्स? नॅफॅझोलिन, टेट्राहायड्रोझोलिन, झिलोमेटाझोलिन and ऑक्सिमेटाझोलिन. So they are used for their vasoconstrictive effect as well as a nasal decongestion and ophthalmic decongestion. म्हणजे आय मसलचं हायड्रेटिक सिच्युएशन करण्यासाठी हे ड्रग मॉलिक्युल्स वापरतात. आता what is the structure of these drug molecules? Imidazole ring मध्ये if this R group is substituted with these many substituents, हा R group आपण या मोइटीने सबस्टिट्यूट केला, that is naphthalene ring, then the drug molecule is naphthazoline. If we are going to substitute this ring with a tetrahydrazolene, so this is the substituent. So here this R is nothing but these many substituents. So these are the various structures of these 2-aryl imidazoline derivatives. Imidazole moiety has a pKa value between 9 to 10. So they are going to have the limited access to the central nervous system. कारण त्यांचा pKa खूप जास्त आहे. So one carbon bridge between the imidazole ring and a phenyl ring, thus it has a phenyl ethylamine structure. Then they are going to have the lipophilic substituent. हे सगळे जे काय आहे ते lipophilic. See, number of carbon atoms increase झाले. म्हणजे हे कसले substituents आहेत? Lipophilic substituents on the phenyl ring may be important for alpha-1 selectivity. See, phenyl ring present असल्यामुळे यांचे जे काही ऍक्टिव्हिटीज आहेत किंवा यांच्या जी काही ऍक्शन्स आहेत दे आर मोर टुवर्ड्स दी अल्फा 1 रिसेप्टर. Then the next class is 2-amino imidazolines. Here there is presence of orthochlorine group and NH bridge. We have seen the general structure in the morning class. This is an imidazoline ring. This nitrogen bridge, X च्या तिथं nitrogen if substituted is there, and if there is presence of orthochlorine groups, so they are going to increase the action. So the name of the drug which is going to give these type of actions, that is presence of imidazole ring, nitrogen bridge, and this nitrogen will attach to the aromatic orthochloride substituted ring. So the name of the drug is clonidine, which is going to be give alpha 2 agonistic activity. See, प्रत्येकाचं contribution different आहे या ring मध्ये. This imidazoline ring, then this is the nitrogen bridge, and this presence of halogen substituted aromatic ring will give what type of action? Alpha 2 agonistic action. So it is also used for the nasal decongestion and for the treatment of hypotensive disorder. Then primarily it is used as an alpha 1 agonist, that is nasal decongestion. This is going to be have a low pKa value due to the presence of this aromatic chloride substituted ring and the presence of nitrogen. That's why it is remain non-ionized and they may cross blood-brain barrier. See, lipophilic and hydrophilic दोन्ही nature असल्यामुळे they are going to have the low pKa value. त्यामुळे ते unionized राहतात, जसेच्या तसे राहतात. So they may cross the blood-brain barrier because blood-brain barrier is very selective in nature to say to absorb or to cross the drug molecules, and as this drug molecule is remain unionized, it may cross blood-brain barrier. So this drug molecule we can use for the CNS treatment also. That's why it is alpha 2A adrenergic agonist in the CNS, causing inhibition of sympathetic output. That is vasodilation, decreased heart rate, and that means we can treat the person with the blood pressure. So we can decrease their heart rate and we can produce a situation that is hypotension. So the next drug molecules are open ring imidazolines. See, in the earlier case, we have seen the imidazoline structure is compact, fifth membered ring, here it is. But if that imidazoline ring is open, so it is converted into an straight chain imidazoline structure. So these are the drug molecules, they are alpha 2 agonist. इथे imidazoline ring जी present होती, which is attached to this nitrogen atom, which is open one. That's why these two drug molecules, that is gonabenzene and gonfacine, are coming under the category of open ring imidazolines. They are all alpha 2 agonists. See, closed ring imidazolines आहेत ते alpha 1 agonist आहेत. पण open ring imidazolines, they are alpha 2 agonists used as a antihypertensive drug. See, मगाच्या केस मध्ये आपण ब्लड प्रेशर वाढलं असेल ते कमी करण्यासाठी त्यांचं ट्रीटमेंट वापरलं. The same is here, because we know alpha 2 is inhibitory in nature. It is going to resolve the increased issues of alpha 1 receptor. So it is used in the antihypertensive drug. The mechanism as like that of same in the clonidine. Clonidine चं mechanism बघितली की तो कशा पद्धतीनं vasodilation करतो आणि heart rate कमी करतो. So same here, they are going to be treat the situation in the same way by vasodilating the blood vessels. Now the next class is very important one, that is methyl dopa. Question will be there in the drug molecule. So what is this? This is here there will be a presence of a same structure, that is beta phenyl ethylamine will be the drug. But this similar type of structure with a beta phenyl ethylamine. So this is L-alpha methyl dopa is a pro-drug zwitterion. The problem with this drug molecule is it is present in the form of zwitterion. Zwitterion means both positive and negative charge are possessed by the drug molecule. Now, this drug molecule act by, which is originally designed as a dopaminergic directly acting inhibitor, but it is metabolized by the enzymes which give the active metabolite, that is alpha methyl norepinephrine. See, हा ड्रग डिझाईन करताना डोपामिनर्जिक ड्रग म्हणून डिझाईन केला गेला, but due to the enzymatic action, that is esterase, it is converted into L-methyl dopa, and this L-methyl dopa, with the help of enzyme dopa decarboxylase, it is converted into alpha methyl dopamine, and this alpha methyl dopamine, it will be acting on the dopamine beta hydroxylase. It is converted into alpha methyl norepinephrine. See, methyl dopaचं conversion आपल्या बॉडी मधील enzymatic reactions मुळे it is converted into our main moiety, that is beta phenyl ethanolamines, किंवा त्यांचं स्ट्रक्चर कन्वर्ट केलं जातं similar to that of catecholamines. That's why this methyl dopa can be act as a selective alpha 2 agonist. So where we are, with the help of enzymatic conversion, it gives an active metabolite, that is alpha methyl norepinephrine, which is a alpha 2 agonist acting in the central nervous system, which will decrease the sympathetic outflow. Sympathetic outflow decrease करतं, म्हणजेच न्यूरोट्रान्समीटरची रिॲक्शन्स, न्यूरोट्रान्समीटरचं ट्रान्समिशन इम्पल्स कमी करतं. That's why they are going to dilate the blood vessel and lowers the blood pressure. Now, the main criteria or the main associated property with this drug molecule is it is available in the only in the oral dosage form. Its ester form, methyl dopa's ester form, that is methyl dopate. This is an ester form, is available in the form of IV formulation. See, actual methyl dopa is available in the form of oral tablet or oral dosage form, but its ester form, जर आपण हा methyl dopa ester form मध्ये convert केला, that is methyl dopate, this is available in the intravenous or IV formulation, and this drug molecule is used as an antihypertensive. Now the next class is beta agonist. See, we have discussed endogenous catecholamines, we have discussed alpha agonist, then we have discussed both dual alpha and beta agonist antagonist. Now we are proceeding further for the beta agonist. What are the drugs which are acting on the beta agonist? Those are isoproterenol, metoproterenol, and terbutalin. They are going to have the change in the structure. Instead of catechol nucleus, they are going to have the resorcinol nucleus. Then the next drug is albuterol, pyrbuterol, and salmeterol. Then the next one will be formoterol, isoethanol, bitoterol, and Rito Drain. Now, out of which all the drugs are not there for your syllabus, just see what are those. Then the beta agonist selective drug molecules are isoproterenol. Now, it is a basically beta 1 agonist. Now, we all know alpha 1 and beta 1 च्या actions quite similar आहेत. They are going to increase the heart rate. That's why it is used for the treatment of heart block. If one person is going to be suffer from the heart break or heart block situation, किंवा congestive cardiac failure झाला असेल, त्यांचं heartच pump करत नसेल, so we can give this drug molecule, that is isoproterenol. It is also a beta 2 agonist by action of bronchodilation. So this is used in the treatment of asthma or COPD, chronic obstructive pulmonary disease. This is one of the asthmatic severe case आहे. या ट्रीटमेंट मध्ये पण आपण हा ड्रग मॉलिक्यूल यूज करू शकतो. हे झाला catechol nucleus containing beta 1 agonist. पण रिसोर्सिनॉल ड्रग कंटेनिंग बीटा 1 अगोनिस्ट कुठले आहेत? Metaproterenol and terbutaline. In this case, if this R is this one, that is a dimethyl moiety, so this is metaproterenol, and if the tertiary butyl moiety or tertiary methyl group is there, then the group then the name of the structure is terbutaline. So this resorcinol moiety ही जी काही रिंग जर आपण चेंज केली कॅटाकॉल पासून रिसोर्सिनॉल पर्यंत, so this is selective beta 2 agonist. Because का हा selective आहे beta 2 agonist? They are going to increase the bioavailability of this drug molecule because it is not metabolized by catechol O-methyl transferase enzyme. Because catechol O-methyl transferase is the enzyme which is acting on the only catechol nucleus and not on the resorcinol nucleus. आणि इथे resorcinol nucleus present असल्यामुळे it is not metabolized by this enzyme, so it is going to have longer duration of action and act by selective beta 2 agonist mechanism. Same type of classes which are there in the beta 2 agonist are albuterol, pyrbuterol and salbuterol. They are going to have 3-hydroxy methyl moiety selective beta 2 agonist because they are not metabolized by catechol O-methyl transferase enzyme. If we are going to change the substitutions, that is, if we are going to substitute this bulkier nitrogen substituents in the case of this R, so they are selective for the beta receptor as they are not metabolized by monoamino oxidase enzyme. N-phenyl beta-oxidase substituent in the salbuterol, it is very long acting. का तर आपण हे ring the substitution is much bulkier group. And the next drug is levabuterol, which is an R isomer of racemic albuterol. This albuterol is going to have its R isomer, and the name of that R isomer is levabuterol. Now, the next drugs are Bitoterol, which is selective beta 2 because it is not metabolized by monoamino oxidase. And this is a prodrug which is resist to the metabolized by catechol O-methyl transferase. As it is a prodrug, this prodrug is nothing but inactive drug की जो आपल्या बॉडी मध्ये गेल्यानंतर ड्यू टू एन्झायमॅटिक रिएक्शन तो ऍक्टिव्ह होतो. Now this bitoterol is a prodrug which is inactive as such, but when it is come in contact with an enzyme that is esterase, will convert the prodrug molecule into a colterol. Colterol, we all know, it is a tertiary butyl moiety or tertiary methyl substituted derivative of a catecholamine. And the next drug is Rito Drain, which is a selective beta 2 agonist, which was developed specifically for the use as a uterine relaxant. As beta 2 receptors are present on the uterus muscles, so they are basically used for the treatment of uterine relaxants. So this is all about the directly acting sympathomimetic drugs. Now we are proceeding further for the indirectly acting sympathomimetic drugs. कोण आहेत ते? Phenyl isopropylamines. Phenyl isopropylamine is the ring present in the indirectly acting sympathomimetic drugs, and the examples of those drugs are amphetamine, methamphetamine and hydroxy amphetamine. हे तिन्हीच्या तिन्ही drugs, they are there for your syllabus. So where we are, they are going to have their mechanism of action by releasing endogenous norepinephrine. See, हे drug molecules direct act न होता, direct receptor ला bind न होता, they are acting indirectly. Indirectly म्हणजे कसे? They are going to stimulate the release of neurotransmitter. आता आपल्याला माहित आहे regularly these neurotransmitters are released in our body, but if there is some problem, So the problem is treated with this drug molecule. Which drug molecule? Indirectly acting sympathomimetic drug. आता हे indirectly act होतात म्हणजे काय करतात? They are going to stimulate, they are going to increase the release of neurotransmitter, that is norepinephrine. They enter the nerve ending by a way of active uptake process and displace. So they are going to, these drug molecules are entered in the nerve ending. That is by which mechanism? Active uptake process and displace the norepinephrine from its storage granules. And the next class is also phenylproparanolamine, and the drug molecule is pseudoephedrine. Now, the drug molecules which are going to be acted by indirect mechanism are amphetamine and methamphetamine. So how they are going to act? They are acting by mimicking. Mimicking means increasing the release of catecholamines, neurotransmitters, norepinephrine and dopamine. ह्या सगळ्यांचा रिलीज इन्क्रीज करून they are going to show their action. Plus, they are going to show the serotonin action. As the structure is going to have not bulkier carbonyl groups or carboxylic acid derivatives, they are going to be, or they may be penetrated in the CNS. So they may stimulate central nervous system and central appetite suppressant effect, shown by both amphetamine and methamphetamine. See, they may ask, what is the drug which is going to suppress the appetite suppressant effect, or which is going to be show this type of effect? And the names of drugs are amphetamine and methamphetamine. Now the next drug molecule is hydroxy amphetamine. In the presence of para-hydroxyl functional group, there is no CNS stimulant action. They are used to dilate the pupils for the diagnostic purpose or for the surgical procedures on the eye. So these drug molecules are used to dilate the pupil for surgical purpose. For the pupils any operation करायचं असेल, so that time dilation of pupil करायचं असेल, then this drug molecule is used for the dilation of pupil for the surgical purpose. So these are the structures, that is amphetamine, methamphetamine and hydroxyamphetamine. Amphetamine structure मध्ये hydroxyl group substitute केला, hydroxyamphetamine and methamphetamine. One of the methyl functional group, that is amine functional group, is substituted with a methyl functional group. Now, the next class is phenylproparanolamines. The drug molecule is pseudoephedrine. Pseudo means competition karnara, फसवणारा. So a beta hydroxyl group has a S stereochemistry, thus no directly acting mechanism, causes indirect vasoconstriction. See, we have seen the drug molecule, that is ephedrine, will have a hydroxyl group in the R position, but if we are going to have the hydroxyl group in the S position, so they are going to be acted by indirect vasoconstriction and nasal deconcentration. So same is the example with the pseudoephedrine and R pseudoephedrine and S pseudoephedrine. Now the next and very important last class is mixed acting sympathomimetic drugs, and the name of the drug under this category is ephedrine. Ephedrine is a phenylproparanol derivative. Ephedrine is a naturally occurring drug molecule in the ephedra. You know the drug ephedra. So this is present in the ephedrine. It is available in the form of 1R2S ephedrine, which is most active from all 4 isomers. An alpha beta adrenergic agonist, that is beta hydroxyl, have R stereochemistry and also enter the release of norepinephrine. It is just a mixed acting, both actions shown by this ephedrine molecule. It has ephedrine can be used for the variety of purpose. It is mixed action आहे म्हणजे तो दोन्हीवरती पण ऍक्ट होतो आणि दोन्ही टाइपचे ऍक्शन दाखवतो. That's why it is used sometime for the purpose of bronchodilator, vasopressor, cardiac stimulant, and nasal decongestant. Then the next class is phenylproparanolamine. It is N-dismethyl analog of ephedrine. See, ephedrine च्या structure मधून methyl functional group remove केला, then it is converted into phenylproparanolamine, which is going to lack N-methyl group. मिथाइल ग्रुप कमी झाल्यामुळे त्याचं पोलॅरिटी वाढली एफेड्रिनशी कंपेअर करता. much less stimulation. It is alpha selective due to increasing in the penetration. It is alpha selective and higher vasopressive action. It is used as an appetite suppressant and cold medications. And but this drug molecule is not nowadays it is used as it is FDA discontinued. Now we have already seen the agonist, the terminology agonist. That is, an agonist is a chemical which binds to the receptor and activate the receptor to produce the biological action. And antagonist हा असा molecule आहे की जो binds to the receptor but block the action. It acts opposite to that of the agonist. So type 1 alpha 1 agonist आणि type 1 beta 1 agonist. Alpha 1 agonist मध्ये alpha 1 agonist आणि alpha 2 agonist. Beta agonist मध्ये beta 1 agonist, beta 2 agonist and beta 3 agonist. So this is very important side. Beta receptor antagonist and non-selective alpha receptor blocker. So these are the structures of the drug. Beta receptor antagonist have structural similarities with the agonist, norepinephrine and epinephrine and isoproterenol. Alpha antagonist कोण आहे? Number of compounds of diverse structure, that is little resembles with the alpha agonist. Non-selective alpha receptor blocker कोण आहे? Tolazolone and phenethylamine. Both are competitive towards the alpha 1 as well as alpha 2. Then selective alpha antagonist कोण आहे? Adrenergic आणि irreversible alpha blocker कोण आहे? Phenoxybenzamide. So these are the drugs which are variety of the drugs used for the treatment of problem which is associated with the adrenergic receptors. Okay, understood everybody? I'll provide the notes. तुमच्या हाताकडून स्ट्रक्चर गेले की तुमच्या लक्षात येईल. What are the simple structure आहे, प्रत्येकाचा यूज काय आहे ते तुमच्या स्ट्रक्चर ड्रॉ केल्यानंतर लक्षात येईल. Understood everybody?
Yes, ma'am.